Hello, everybody. If you are seeing this face for the first time, my name is Janje, and my YouTube page is Health Talk with Janje. So, have you ever been in a situation where, let's say, you are having one medical issue or another, whether it be headache, something wrong with your nose, or something wrong with your teeth, your foot, or any health issue? You went to the doctor, and then you explain the situation. Oh, doctor, I came to see you because I've been having this really bad headache, or I've been having a chest pain and it's not going away. I've done X, Y, and Z, but I don't seem to it's just there. It's not going away. And then after explaining everything to the doctor, then the doctor said, okay, so I'm gonna send you to see this such and such doctor. Then you're sitting there, you're confused, you're like, maybe in the back of your mind, we're already saying it for the doctor to hear you, like, why is he sending me to another doctor? I thought you were a doctor. Aren't you supposed to know everything? That's why they call you doctor. I come to you and I tell you what's going on with me, and you're sending me to this other doctor. And then you leave that office, you're so confused. You wonder, what is that? And maybe even the name, you don't even know how to pronounce the name of the doctor or specialist that your other doctor is sending you to. So today, I'm going to be sharing with you 10 medical specialists and what they manage. So next time when you go to visit your doctor with one issue or another, and the doctor decides to send you to another doctor, it's not that the doctor is not capable of taking care of you, but the reason is that no one doctor specializes in everything. Just like no one person knows everything, each doctor has their specialist. So if it's something that they cannot handle, or if it's outside of their scope of practice, then in that case, it will be in your best interest for them to refer you to a doctor who specializes in that particular disease or illness or issue you are having. So I'm going to share 10 medical specialists and what they manage. Okay, so the first one is the primary care doctor. So I'm going to, as you see, so your primary care doctor, oftentimes you will hear healthcare professionals saying PCP. PCP simply means primary care doctor, or your primary care provider. So you see this doctor handles general issues like general wellness issue, like for annual checkup, not just general well-being. They manage your general well-being. In most cases, they are the first contact that you will see. And from this doctor, you may be referred to another doctor if somewhere down the line you start developing other issues that need more specialized care. So your primary care doctor handles general issues regarding your care, and they are the first contact that you will see. So speaking of the primary doctor, it is best, and I want to encourage you all, especially those of us that are living abroad, or even if you're in Africa or Europe or any other part of this world, it's important that once a year you visit your primary care doctor. In America, if you have insurance, this visit is free. You don't have to pay anything out of your pocket if you have medical insurance. So your primary care doctor will they will check your blood pressure, they will do general assessment, look in your eyes, your ears, your mouth, they will listen to your lungs, they will listen to your heartbeat to see if there's any irregular heartbeats or anything abnormal. And if they find something that's abnormal, that's outside of their general scope of practice, then they will send you to another doctor that specializes in that thing. Usually they will try to manage it on their own, but when it gets to the point where you need to see a specialist to manage it, if it becomes uncontrolled, then you will be referred to a doctor who specializes in that area. So your primary care doctor, make it a point to visit them once a year, or if they need to see you more often, they will let you know. Okay, so they manage your general overall well-being, and they are the first contact for your health care. Now, the next doctor specialist is your pediatrician. So just like the primary care doctor, most primary care doctors deal with adults. There are some, however, that will manage from birth up to the elderly patient. But then there is the pediatrician. So the pediatrician manages diseases and conditions. They are like the first contact for the younger ones. So from birth up to the age of 18, they will be seeing your pediatrician. So if you have a child that's under the age of 18, I will encourage you to schedule a visit once a year, if not more, as recommended by the pediatrician, for them to be checked for their well visit. Same thing like with the adult, they will check their eyes, their ears, their nose, their throat, their breathing, their stomach, and then if the kids need any immunization or vaccination, they will make sure they keep them on schedule to give those vaccinations to them. So your pediatrician is the first contact for the kids too, as well as the primary care doctor is the first contact for adults. The next specialist is your cardiologist. So cardiologists, they deal with any diseases or illness. They manage those things that affects your heart and your blood vessel. So if you have chronic high blood pressure, or if you've been having issue with irregular heartbeat, where your heart is beating, out of the regular way it should be, and in pain, tightness in your chest, you will want to make sure that you are being followed by a cardiologist. They sometimes manage your blood pressure too, to make sure that your blood pressure is being managed, because anything that has to do with high blood pressure, it also affects your heart. So your cardiologist, if you are living with high blood pressure, you want to make sure that you are being followed by a cardiologist. And then the next doctor is your nephrologist. So nephrologists, they diagnose, treat, and manage any disease that has to do with your kidneys. Again, like I said in previous videos, high blood pressure and diabetes are the two primary causes of kidney disease. So if you are living with chronic high blood pressure and diabetes, you want to ensure that at some point your primary care doctor is referring you to see a nephrologist, so they manage any acute or chronic diseases that has to do with your kidneys. And the next doctor is called the pulmonologist. Okay, so this doctor manages any disease that has to do with your respiratory system, which is the system that helps you breathe. So like your lungs or other organs that help you breathe, your mouth, nose. So anything that has to do with your breathing, you will be referred to a pulmonologist. So for instance, if you have asthma, if you have pneumonia, if you have lung cancer, sleep apnea where you can't sleep at night, emphysema, any disease of the lungs, emphysema, and what is called chronic obstructive pulmonary disease, which is short for COPD. So any of those conditions, your primary care doctor will most likely be referring you to see a pulmonologist. And then we have hematologist. So heme or hema simply means blood. So if your doctor refer you to see a hematologist, these doctors specialize and manage and treat diseases that has to do with your blood. So if you have like sickle cell, any cancer of the blood like leukemia, or chronic anemia where your blood count is so low, or disease of your platelet, your primary care doctor will be sending you to see a hematologist, and these doctors will manage your blood condition. Next we have oncologists. Okay, so oncologist has to do with cancer. So if it's you or a friend or family who is living with cancer, you will be referred, or who's been diagnosed with some cancer related disease, you will be seeing an oncologist. And then I have the endocrinologist. This doctor deals with anything that has to do with your hormone or your hormonal glands. So if you have disease like diabetes, thyroid disease, anything that has to do with infertility, or osteoporosis, which is disease of your bones, most likely your primary care doctor will be referring you to see an endocrinologist. So if you have diabetes, ensure that you are being followed by the endocrinologist. They will prescribe your diabetes medication, your insulin, or your diabetes pills. And then another thing just to throw in there, if you have diabetes and your doctor saying you to see this doctor, the endocrinologist, and they give you a blood sugar monitor, if you don't know how to use it, do not go home and confused and don't check your blood sugar. Ask the staff, the workers that work with this endocrinologist, let them know that you need help on how to use your glucometer. Because if you don't know how to use it, how can you monitor your blood sugar, and how can they dose you properly for your insulin and your diabetes pills? All right. And this other doctor is called an ophthalmologist. So this doctor specializes in any disease that has to do with your eyes and your vision, how well you see. So if you have like glaucoma, or where you're losing your eyesight, I keep going back to these two, diabetes and high blood pressure. So if you have diabetes, you most likely, depending on how long you've been living with diabetes, because diabetes over time damages your eyes. And that's when you see some people in their adult life, they go blind. It's all because of the diabetes. It kills the nerve and stuff in your eye. That can lead to sudden blindness. So if you have diabetes, you want to be seeing these doctors at least once a year or as recommended by your doctor or the ophthalmologist. Podiatrist. Podiatrist. This doctor manages disease and condition that has to do with your foot, your ankle, or any structures of your legs. Again, if you have diabetes, it affects your feet. So you will be followed by this doctor. If you have foot issue over time, diabetes kills the nerve endings in your feet, and you may hurt yourself and not even feel it. Or you, because with diabetes, when the nerve endings are killed in your legs or your feet, you won't feel if something hurt you. And if it stays there untreated, it can get infected. So with diabetes, make it a point to see this doctor at least once a year or as recommended by your pediatrician or by the podiatrist. So those are the 10 medical specialists and what they manage. Now I'm throwing two other ones there as a bonus. So the first one is gynecologists. The gynecologists, they specialize in the health of women reproductive system. So if you have any cancer of your reproductive system or issues with menstrual periods, infertility, infection, urinary tract infection, you will be followed by this gynecologist. So if you have any of these issues, if you go to your primary care doctor, if they can't treat it, they will send you to see a gynecologist. And lastly is the dentist. Dentists specialize in your teeth. So if you have a toothache or you have gum disease, you will be seen by the dentist. I remember when I first came to America, this is just a trainer. I first came to America, I was a teenager, and I had this really bad toothache. I got done eating, I decided to pick in my tooth, and as I was digging. Next thing I know, there was a big hole in my tooth. It hurt so bad. I crushed Tylenol, aspirin, whatever I could get my hands on, and I stuck it in there, but the pain was so much, and I was crying. I drove myself to my primary care doctor office, and guess what? I was referred back to the dentist. So it's important to know these medical specialists and what they manage, so you don't go to the wrong doctor, or if your primary care doctor refers you to them, do not get offended, do not feel bad, do not think that the doctor, what good are they if they can manage something, because no one doctor specializes in everything. They each have their different specialists. So I hope this was helpful. Thank you. If you have any suggestions for any topics or anything that you want clarification on, please feel free to visit my YouTube page, Health Talk with Janje. You can leave a comment, or you can leave a comment or write your questions there. Okay. Thank you. Bye. Have a blessed day. Stay safe.